Hi, it's Dr. Rosario from Andrus ENT and Sleep Center. Thank you for choosing us for your care, and we love taking care of you, and this video is designed to help you remember some of the things that was said in the office, so you have a digital playback of all the important things that you need to know. I'm going to talk about septoplasty. So the septum is that midline thing that gives you two nostrils, and so we've decided that you need to have yours corrected. The post-op course, recovery in general is about a week. You have splints in place that stay in for about a week. And those splints, and I'm gonna just move and get a copy of those. So the splints look like that. So you can see they've got a plastic opening, and you can see it in the nostril there. So those are gonna stay in your nose for a week. When you wake up from surgery, you will more than likely have bleeding from the nose, sometimes one side more than the other. That is okay. If you ever feel like you're bleeding too much, I have you bend your head, and it should be drip, drip, not steady stream gush. You'll have a little gauze pad under your nose that you can change as needed to slow down any bleeding. Again, always feel free and know that we're just a phone call away if you're ever bleeding and going, is this too much? What should I expect? You're gonna use saline sprays in your nose multiple times a day. So the saline sprays will help to keep the blood from crusting, and as well keep that stent open so that you have some breathing room. Because even though I've fixed your septum and shrunk the turbinates, you get postoperative swelling. And so with that swelling, that would impede your breathing. And if the stent gets clogged with blood, then that also affects your breathing. So saline multiple times a day, truly no such thing as too much. And then you're also gonna do Afrin, which is the decongestant, but that's only for 3 days, and that helps to slow down the bleeding. And you would do the Afrin twice a day, or even sometimes 3 times a day. But for the first 3 days, if you're feeling like you need to use it longer or more often, please call so we can talk about it. Your front teeth are right behind them, might feel a little weird or numb or a different sensation, or your front, like top of your lips, normal. The nerve that goes to the upper teeth is in the bone, in the maxilla. And so just by having surgery on top, you can get some swelling or sensation. You can still eat whatever you would like, no restrictions at all. Your activity restriction is gonna be less than about 20 pounds lifting. If you're an adult, less than 5 to 10 pounds, depending on your age group and overall physical build. So take it easy. This is time to take care of you. Things to avoid getting shower water up your nose. While it's good for your GI system, or acceptable for your GI system, not great for your nose. It's an open wound, so do not do this and get shower water up there. If you use a neti pot, you can use it. You do want to boil the water for at least 5 minutes and let it cool, and then you can use it in your neti pot. If you're in CPAP, please use your CPAP, as we've said in the office, and you just need to clean your mask out more often, but you want to use your CPAP the entire time. From an activity standpoint, we'll tell you when you can go back to the pool and back to the lake, so try to avoid submerging in any type of water during this healing time. Again, call with any questions, and we're happy to answer and make sure that you have the answers that you need. Okay?